Hi there, everyone. I'm Dr. Andrea Purcell, and I am so happy to be having this conversation with you this evening. Female sexual dysfunction is one of the top 5 complaints of menopausal women, and it is something that I hear about every single day in my practice. So it's something that a lot of women want to know about, but not that many people are talking about. So this is February, it's February 2nd, and it's the month of love. So we're going to talk about sex, we're going to talk about sex drive, we're going to talk about lubrication, orgasms, and how it all interrelates and connects with perimenopause and menopause. So I really want you to get informed on this topic so you understand what is happening and you can help yourself rekindle your love life and reconnect with your partner and most importantly, yourself. So with that, menopause, the official definition of menopause is not having a menstrual cycle for a year. And menopause is a really big deal, okay? It's not a disease and it's not life-threatening, but what menopause is it's a game changer in a lot of ways, and many women are surprised by this and they don't realize what's actually happening. So menopause is a physiological shift. It's a change in your physiology. And what happens when your physiology shifts or changes is that you don't feel like you are in your body anymore. You feel like something has taken over your body. Like one of the things that I've heard a lot of my patients say is, whose body is this? What happened to the old Carol? Or what happened to the old Cindy? Or, where did I go? So we feel displaced, and this happens in menopause big time, and it definitely happens with sex and what we expect our body to do or respond and how our body is not responding. So sexual sensitivity changes, sex drive and desire change, lubrication changes, the ability to orgasm changes. It all changes up on us, and it's a little unsettling. We don't know what's happening and it doesn't feel good, and it's like the body that we once relied on is no longer responding in the same way. So, we get disheartened, we get confused, we start to feel guilty. This affects our relationships, this affects our body image, and ultimately leads to unhappiness. So let's try to understand what's really going on here and help you reduce some of that emotional burden a little bit. I had a patient say to me, God took it away. It meaning her sex drive. She's like, yeah, I had it for all these years and I think I took it for granted and now it's gone and I have no desire at all whatsoever. And she says it's gotten so bad that, we've had to schedule it on the calendar, so that I can make time and my husband feels like he's, on my radar. And then plus, to boot, it's so painful, right? So, and then she said, oh, but, I use coconut oil, but that just doesn't really cut it. And I know a lot of women are using coconut oil, so we're going to talk about coconut oil a little bit later on briefly. So some women experience dryness and irritation right when they get into menopause, but other women, it can take 5 or 10 years before it really affects sexual function. So what's happening is over time, the loss of estrogen is causing a dehydration and thinning of the vaginal tissue. And for some women, it happens sooner. For other women, it happens later, but it will affect sexual function, and then cause some micro tears in the tissue, which could lead to more vaginal and urinary tract infections and absolutely painful intercourse. So what's the deal? What is the deal with menopause? I hear this a lot. oh, I'm done with menopause. I had those hot flashes and they went away, and I just moved through menopause. That's what you think, sister. But what I want to share with you tonight is you just entered the queendom of menopause and you're not getting out. You're not getting out for a long, long, long time. So think of it this way. Are your hormones going to come back? Are you going to start menstruating again in the next 10 or 20 years? No and no. So what that means is that your fertile years are behind you. Your menstrual cycles are behind you, right? So goodbye fertility, goodbye regular pap smears. So now the question is, what's in front of you? What's in front of you is learning how to navigate the waters of menopause. So it's hello, menopausal risk factors. It's hello, menopausal body. It's hello, menopausal sexual function. It's hello, menopausal metabolism. You see where I'm going with this? Are you starting to get a little bit of the picture here? The game has changed, ladies. So what do we need to do? We need to huddle up. Let's figure out what the best thing is to do for you so that you could figure out what the rules of the new game are to help you enhance your sexual function in menopause, right? This is hands down the best way to go. You got to figure out what the rules are so you can know how to win the game. And then you can live gracefully in your menopausal body instead of feeling betrayed and bucking, this body that you now have. So again, a whole new set of rules apply, new exercise requirements, new food requirements, new hair care products, new skin care products, right? So new things that you have to do to help your sexual function. This is all part of the new game. So the way that you used to have sex and take things for granted is in the past. You can't rely on that anymore. It's not going to work. So the new rules require a new understanding of your body so that you can have a healthy sex life in menopause. And hormones rule women. Okay? Hormones affect our moods and they affect how we relate to the world, whether we're happy, sad, flirty, playful, or just downright cranky and irritable. So they affect our hair, our nails, our joints, our bones, our heart, our brain, and our sexual organs. So sex shouldn't hurt. Sex should not be painful. Sex is good for us. It's good for our vaginal tissue. It's good for our relationships. It's good for managing stress. It makes us feel connected, happier in general. And there's this really cool hormone that women have called oxytocin. And oxytocin is the hormone that's released under intimacy, or like when we're intimate. And the best way I can explain it is if you remember back when you've ever had an orgasm, it's that feeling after the orgasm where you're so relaxed and you feel loved and cared for, and really no stressor is going to affect you in that place. So it's a really good feeling, and that's one of the reasons why sex is so good and so healthy for us. So the three main complaints that I hear on a regular basis from women dealing with sexual dysfunction in menopause are: one, loss of libido. I just have no desire. I have no drive. Two is inability to orgasm. I used to be able to orgasm and now I can't. And the third one is painful intercourse, mostly caused by vaginal dryness. So those are the top three. And of all of those, by far the most common is lack of interest. Like, I just lost interest. I don't think about it anymore. It's not on my mind. Like, I don't initiate. And then for cancer thrivers, if I have any of you watching this, research shows that 83% of women report sexual problems after having a gynecologic cancer. So endometrial cancer, cervical cancer, uterine cancer, and 90% of women report sexual problems after surviving and thriving from breast cancer. Okay, so you're in your own little special category there. I think it's really important if you're dealing with any of these issues to work with an alternative practitioner who can help you navigate these waters, who's well versed in treating cancer patients and who knows what your individual needs are. Okay, so sexual dysfunction that occurs in and around menopause is really lumped into the category of pelvic floor disorders. And you can think of it like this: when you sit cross-legged on the floor, there's an entire network of muscles that's at work to hold up and suspend your organs and make sure nothing falls out. And these are your pelvic floor muscles, and they literally hold everything just like this. And they work hard to make sure everything stays in place, you know, under a constant gravitational pull. But as we get older, the laxity of abdominal muscles and back muscles and even the pelvic muscles cause and contribute to some of the issues that we deal with sexual dysfunction. There are other things like organ prolapse and urinary incontinence. And then there are a whole host of conditions that specifically affect menopausal women that target the vagina, labia, and clitoris. And some of those things are chronic urinary and vaginal infections, lichen sclerosis, lichen planus, inflammatory skin conditions, and other things. One of them is called vulvodynia or vestibulodynia. But there's also some lifestyle things too. So depending on how your overall health is, it can enhance or take away from your sexual function in menopause. So some of the risk factors and things that affect and diminish sexual function are obesity, so having a higher body mass index, history of diabetes, depression, insomnia, and if you're on any of the SSRIs, antidepressant medications. And then conversely, having some healthy lifestyle habits will help your sexual function and offset some of the effects that hormones are having on your sexual health. So regular exercise is a good idea just for everybody on so many levels, but eating a whole food diet, let's say a Mediterranean diet, lots of nice fruits, having good social support, and then having a normal BMI or a normal body mass index. But for the most part, the decreased sexual function that happens in menopause is related to hormones. So I want to talk more about hormones now. Essential hormones like estrogen, progesterone, testosterone, and DHEA are critical for healthy sexual function. And all of these hormones affect our brain chemistry. So hormones have a way of acting on the brain chemicals called neurotransmitters, and specifically epinephrine, norepinephrine, and dopamine. So this is the premise behind prescribing women antidepressant drugs and the science behind the most recent drug released and approved by the FDA called The, which is a neurotransmitter boosting drug to help boost sexual desire in women and specifically acting on dopamine. But, you know, it's got side effects. Fatigue, dizziness, can't be taken with alcohol, interferes with other medications. And this really is the problem with prescription medications. I mean, and non-bioidentical hormones, because they're synthetic, they're foreign to your body, and they cause side effects. And nobody wants side effects. I don't want them. You don't want them. So that's the reason I specialize in natural medicine, because the beauty of natural medicine is it serves up, you know, the benefits of symptom relief with the side benefit of good health and doesn't have any of those negative side effects. So it's really just a beautiful thing. You know, and additionally, many of you may have experienced issues with your partner. Maybe your partner is on blood pressure lowering medications. Blood pressure lowering medications will cause erectile dysfunction and they will prolong orgasm, which may be bad news for you if you have vaginal dryness, because if it's taking your partner longer to orgasm, that means more friction, which means potentially more pain for you and dryness as a result. So it's not just you, right? Your partner is going through body changes as well, and it just really takes good communication and laughter to work it through successfully. So, lighten up a little bit, give yourself a break. So if you've had a good sex life before menopause and now you don't, the two most common reasons are going to be because of painful intercourse and no desire. So are you not in the mood because you think it's going to hurt? And pain is the fastest way to get out of the mood. I mean, no one wants to do something that hurts. Ouch. So why are you in pain? Well, most likely it's because you're experiencing vaginal thinning and lack of hydration or dryness, and that's contributing to the problem. Yeah. So the main cause of vaginal dryness is decreased estrogen, lack of estrogen. And the main cause of lack of desire is decreased DHEA and testosterone. So estrogen just plumps everything up. It keeps things juicy and hydrated and bouncy, and that's the way you want your vagina to be. So less estrogen, less juice, less plump. It's thinning, and that hurts. So there are a number of hormonal and non-hormonal options for vaginal dryness, and I am going to cover them, but first I want to talk about hormones. So if a hormonal option is necessary for you, I use bioidentical hormone preparations. They are the exact match of hormones that your body produces, and they're prescribed through a compounding pharmacy in the exact dose that you need. So there are little to no side effects using bioidentical hormones. They are not FDA approved because they are not patented drugs, because you can't patent a natural substance. Conventionally trained gynecologists prescribe the FDA-approved drugs for sexual dysfunction in women, and some of the most common are conjugated equine estrogens, also known as Premarin. Another very common one is called estrase. Premarin is synthetic, and it's been shown to cause breast cancer, heart disease. These are not bioidentical. So most of the women that I see prefer to avoid using anything synthetic, and especially synthetic hormones, because they're linked to other health problems. And if you're a cancer thriver, you may not be willing to use hormones or may not be able to use hormones. So I do want to cover the hormonal options here now for vaginal dryness, and I'll also cover the non-hormonal options, okay, right after that. So if your vaginal tissue is very thin and sex is very painful, hormones may be a good idea temporarily to help get the tissue hydrated and plumped up faster and get you the results you're looking for, which is to have better sex. You will need to work with a doctor who is properly trained, who knows both the conventional approach and the natural, who's able to prescribe hormones, and specifically the bioidentical hormones for you, so you could be presented with all of your options. So topical hormone preparations to the labia and clitoris could involve estriol, which is a weaker estrogen, estradiol, which is a little bit of a stronger estrogen, testosterone and or DHEA, which could absolutely help with libido and sex drive and your ability to orgasm. And then some women may need bioidentical estrogen and progesterone, like in a cream, rubs into their arms or legs, that they use more systemically because they're having additional menopausal symptoms aside from the sexual dysfunction. Yeah. So what are some of the non-hormonal options for vaginal dryness. Well, the first one comes from Mother Nature, and it's good old fruits and vegetables. I mean, you want to eat fruit to bear fruit, right? And so it's not that your ovaries are going to start working again and you're going to start dropping eggs, but fruit is deeply, deeply hydrating to your skin and your tissues. And it's filled with an amazing array of phytochemicals and vitamins and nutrients and antioxidants that are all completely anti-aging. So don't skimp on the fruit. The fruit is actually very good for you. It keeps skin supple and hydrated and nourished. And there really are a reason for all of those cliches. You know, an apple a day keeps the doctor a day, the fruit of my womb, the apple of my eye. You know, they're just, they're important, and fruit is important for you and for your health. So there's a juiciness about fruit that causes a juiciness in your body. All right. And now number 2, non-hormonal option would be something like a vaginal moisturizer. Vaginal moisturizers are not lubricants. They're moisturizers. And 2 of the most common vaginal moisturizers found over the counter at your local pharmacy, like a CVS, a Walgreens, would be Luvina and Replens. And I actually do have a sample here of Luvina that I can show you. This is Luvina, vaginal moisturizer. And Luvina also sells a personal lubricant, so do not be confused. They are not the same thing. Moisturizers are used more behind the scenes to plump up and help the tissue, hydrate it, and then lubricants are used during sexual intercourse to help support the tissue and reduce the frictional rub, and of course help lubricate you. The other lubricants that I like that are sold out there now are the seaweed-based lubricants, and one of the most common is called Sliquid. And those, you know, all lubricants are used, you know, for intercourse and to help with lubrication. A lot of women are using coconut oil out there. Coconut oil is great for your health. It's a fair lubricant. It probably gives you about 10 minutes of hydration, and then it starts to dry out, and then the pain can return. So it really depends on how far along the spectrum you are with pain and how thin the tissues are as to whether coconut oil will work for you. Coconut oil does have some good other properties, which are naturally antifungal, which will cut down on infections, specifically yeast infections, like if you're having micro tears and some yeast decide they want to start multiplying in there. So the plan is for you to have a plan A and a plan B to help your vaginal health. So your plan A is going to be something that is working behind the scenes, something like this Luvina, or a hormone-based estriol, estradiol, helping to nourish the tissues. And then also using a plan B, which is a personal lubricant like coconut oil, or this happens to be the Luvina one, or the seaweed-based lubricant called Sliquid, or something else like that. But I really hope that this has helped shed some light on what's going on in your life. And if your sex drive has been put on hold for a while because of some of these issues, I hope that this has helped you tonight. So that you are able to rekindle your relationships and really get some direction. And so this isn't one of those topics that everyone still wants to know about, and yet no one is talking about. So once you get yourself balanced, and if you're having a hard time and you follow this and you really need to work with a doctor, again, I do recommend that you work with a doctor who's trained in both the conventional and knowledgeable about the alternative to give you your whole gamut of what all your options are. You may need to be the one to initiate with your partner. Okay, you may need to be the one to reach out and let them know that they have the green light to be intimate. Because chances are that they may not know, what's safe and what's not safe, and where you are with things. So once you get yourself built up and you know what's happening with you, you're probably going to need to be the one to reach out. So thank you so much for joining me on this, and so much love to you in the month of February, and for healthy sexual relationships. Take good care. Mwah.